Hello everyone, this is a live stream. In this live stream we will talk about an important research subject that many people and many students need to know. Subject is about a research of ways of isolation in operative dentistry. We will write it and research about ways of isolation in operative dentistry. Let's make the chat available. Let's write something in the chat for a test. Research about ways of isolation in operative dentistry. There are many ways in operative dentistry can affect the patient. And can contribute to the health of the patient. Some of these ways of isolation are in operative dentistry. Now we'll make a research and we will write all these informations in this text text program about ways of isolation in operative dentistry. Ways of isolation in operative dentistry. We'll write a summary here. And we'll write a conclusion. Let's begin searching for this subject. What we maybe find something related to a research or a video that explains the ways of isolation in operative dentistry. The ways of isolation in operative dentistry, just checking the stream here, if it works correctly. This was a test. To check the stream and see if everything is working as it should be. Isolation of the operative field. Slide share. Here we can see many subjects and many resources talking about the subject, which is very important in dentistry. Department of Conservative Dentistry and Endodontics. There's about 200 slides talking about this subject. Isolation of the operative dentistry. Of course, this was the first link that we researched for on the internet to find ways of isolation in operative dentistry. This subject is about isolation and has many many ways of isolation in this PowerPoint slide share. Of course, the content being the introduction, needs for isolation, goals of isolation, classification, rubber dam is history, advantages and advantages, contraindications, materials and instruments, and recent advances, rubber dam placements. Research advances and rubber dam placements. Let's move on to the next slide. We have other methods of isolation, which include cotton rolls, cellulose, wafers, DRI angle, gauze piece, throat shields, suction devices, mouth probes, Svidopter isolate, hygroformic saliva ejector, VAC ejector, and fast dam. Of course, there are many problems with solving the field of isolation and isolation of the teeth with inadequate crown structure and distincting the operative field and conclusion. There are many slides here we can take a look and see. For example, this one here, we have the contraindications, the asthmatic patients, and many slide share videos for visual aesthetic, for e-learning and test prop GRE, learning the basics of branding, which is all about the isolation of the operative field. Isolation of the operative field. There are many comments here, and here there are lots of comments, as we can see, about this SlideShare project, which can use accessories, rubber dams, all in hope of isolation of the operative dentistry. We can, of course, read this all and make a conclusion here in this text as a paragraph here and write the conclusion. We'll take a general look of what is on the internet about this subject, and later we will decide which materials we should be using in the conclusion of this research. There is isolation in dentistry, SlideShare, isolation of the operative field, 2015. We can see this also. Another source for PowerPoint project, 188 slides, can be helpful in our research and can, of course, add something to the project. I don't know if the video is working, but probably it is working, so I shall continue. But just checking, quick check, just to make sure that the video is working. It seems like the video is working fine. And we shall continue the subject right away. After seeing if the resolution is okay to continue. Here we have isolation in dentistry and this SlideShare project. This SlideShare presentation by Dr. Neeraj Kinirawala. This is his name. Of course, this SlideShare project, this PowerPoint has 188 slides, with the contents being the introduction, goals of isolation, isolation from moisture, direct methods. This is isolation from moisture, rubber dams, cotton rolls, absorber holders and evacuator system and saliva injector, gingival retraction cord, mouth props, indirect methods, comfortable position of the patient and relaxed surroundings, local anesthesia and drugs. There is isolation of soft tissues, retention of the cheek, lip, and tongue, retention of the gingiva, and conclusion, of course. Let's see what is in the conclusion, because this is what we are here for. As we want a conclusion for this subject. It's a very important subject in dentistry, ways of isolation of operative dentistry. These are the references. And these are some mouth pieces. Dry field isolation. Chemical-mechanical means. Gingival retraction cords. Types of retraction cord. Coarse, fine, and cotton synthetic. This looks like a good SlideShare PowerPoint to review later. In order to extract the information that we need of this subject. The subject of ways of isolation in operative dentistry. Moving on to the next link, we have the tooth isolation in dentistry as in general surgery, isolation of operative field in imperative even for a simple filling. Furthermore, an endodontic treatment should not be tooth isolation. The rubber dam, Dr. Ahmed Al-Jiburi. This looks like a good paragraph or PowerPoint talking about the isolation or tooth isolation. This here is tooth isolation. This is the subject we came for and want to make a conclusion, to write it down and present it in order to understand the ways of isolation. This is the PowerPoint that we are looking for to understand the rubber dam and the tooth isolation process. It's talking about the rubber dam in 1864, about 151 years ago. The need to work under dry condition free of saliva has been recognized for centuries, and the idea of using a sheet of rubber to isolate the tooth dates almost 150 years. The introduction of this notion is attributed to a young American dentist from New York. His name is this, Sanford Christian. Stanford Christ Barnum, who is in 1864 demonstrated for the first time the advantages of isolation in isolating the tooth with a rubber sheet. Next we have this, which is at that time keeping the rubber in place around the tooth was problematic, but things soon improved a few years later when 1882 with the introduction of the rubber dam, punch similar to that used still now, rubber dam punch. This rubber dam punch is very important in dentistry, which is still used now. In the same year, Dr. Delos Palmer introduced a set of metal clamps which could be used for different teeth, The quality assurance guidance of the American Association of Endodontists says that cleaning, shaping, disinfecting, and obturation of all canals are accomplished using an aseptic technique with dental dam isolation whenever possible. This is the Association of Endodontists. According to the author's opinion, when it's not possible, the clinician has two options. One is to make is possible, and the other is to extract the tooth. There is no other choice. According to the author's opinion, when it's not possible, the clinician has two options. One is to make it possible, and the other is to extract the tooth. There is no other choice. This is according, of course, to the author. According to the author. There are many slides in this PowerPoint talking about the rubber dam and how it's applied, and the clamps of the rubber dam, how it's been applied, how it is now being applied to the patients in this century, here and here, with the dental floss. Of course, the assistant is having a crucial role in applying or helping the dentist in applying the rubber dam, as we can see here in these two pictures. Of course, the first one is when the assistant helps the doctor here to hold the rubber dam and apply it to the patient. And here is the clamp is being used, as we already said. Many accessories are important, like the rubber dam lubricant and the rubber dam napkins. Before positioning the dam, it is advantageous to lubricate the inner surfaces well with Vaseline or more simply soap, so that the sheet will slide better over the contours of the teeth, more easily overcoming the contact area close tightly around the cervix of the teeth. The cervix of the teeth. Continuing this PDF, it's very important PDF talking about the rubber dam and how it is applied to the patient. There are, of course, special elastic wires. Special elastic wires are also available in different thickness. It stabilizes the dam by passing below the contact areas of the adjacent teeth or same teeth. And these are the special elastic wires. Special elastic wires. And the clamp which was interfering with the mirror in the case, therefore the elastic wire were used. The clamp which was interfering with the mirror, therefore the elastic wires were used. And this is the way of positioning the rubber dam with a metal clamp in the mouth of the patient. Of course, the rubber dam being the most important tool in isolation or in isolating the teeth from saliva. The rubber dam is a very important tool in this subject. Let's check the stream if it's still working. It looks like it is still working. And moving on to the next link, talking about the ways of isolation or ways of isolating the teeth. Here we have attitude and knowledge of isolation in operative field from the www.ncbi.nlmnih.gov, a very trusted site in this subject. And the PDF, of course, being the altitude and knowledge of isolation in operative field. Isolation cannot be achieved for the restoration of the operative procedure without using keywords isolation, operative dentistry, rubber dam. Here we have the abstract. We can read this, but it is better for the website to read it for us. Let's try this. This is a test to see if the website speaking tool is working or not.
Objective.
There was a little problem we faced. Technical difficulty, but now it is working again. And we shall read this text Of course, the stream is working. Just checking. Probably it is working right now, but we will check again just to make sure. Okay. Probably it is working right now, but it is working, so let's read this subject, this abbreviation or abstract. There's talking about the isolation of the teeth in operative dentistry. This abstract
Abstract. Objective. The purpose of this study was to evaluate the general attitude of undergraduate dental students toward rubber dam use, specifically focusing on operative procedures before starting to serve community. Methods. Questionnaires were distributed to undergraduate clinical year students of 2 private colleges, Al-Farabi Dental College, Riyadh, KSA, and Barada Private Colleges, Qasim, KSA. Questions were asked about areas where the students used rubber dam in operative procedures, in which types of caries classes, and in which type of restoration they frequently used the rubber dam. Results. We found that students of both private dental colleges agreed with the opinions that proper isolation cannot be achieved for the restoration of operative procedures without using rubber dam, and restoration placed under rubber dam have a greater longevity than those placed without. Conclusions. Within the limitations of the present study, it can be concluded that the perceptions of dental students on rubber dam need to be improved and strategies should be developed so that this valuable adjunct will comprise one of the indispensable elements of dental care. Keywords: isolation, operative dentistry, rubber dam. Go to.
Okay,
Introduction. Rubber dam is universally acknowledged as a mandatory adjunct, particularly.
This should be enough. This is very important. Here, the results and the conclusion. That's why we have to read it again with the other voice.
Results. We found that students of both private dental colleges agreed with the opinions that proper isolation cannot be achieved for the restoration of operative procedures without using rubber dam, and restoration placed under rubber dam have a greater longevity than those placed without. Conclusions. Within the limitations of the present study, it can be concluded that the perceptions of dental students on rubber dam need to be improved and strategies should be developed, so that this valuable adjunct will comprise one of the indispensable elements of dental care. Keywords.
As we saw, the results and the conclusion were very important in this subject. We shall repeat them. That the result, we found that the students of both private dental colleges agreed with opinions that proper isolation cannot be achieved for the restoration of operative procedure without using the rubber dam. The rubber dam, that's why it is very important in operative dentistry. And let's make the, okay. Just 1 second here. There's a problem we're facing with this website. Let's see if it's working right now, but I am not sure that it is working. Okay, now it is working. Somehow it was not working for this minute. Let's continue reading the results and the conclusion of this study. Results from that the students of both private dental colleges agreed with the opinion that proper isolation could be achieved for the isolation of operative procedures without using rubber dam, and restoration placed under rubber dam have a great longevity than those placed without it. So we put the restoration, it is very important to put the rubber dam in the procedure. And the conclusion was something like, within the limitations of the present day, it can be concluded that the perceptions of dental students on rubber dam need to be improved, and strategies should be developed. Strategies should be developed so that this valuable adjunct will comprise one of the indispensable elements of the dental care. Of course, the perception of dental surgery from rubber dam need to be improved, and strategies should be developed on this valuable junction. So this valuable adjunct will comprise one of the indispensable elements of dental care. Keywords being the isolation, operative dentistry, and rubber dam. There is the introduction here. We can read it very fast, just like that.
Introduction. Rubber dam is universally acknowledged as a mandatory adjunct, particularly during endodontic treatment. Many authors advocate its usage and encourage practitioners to adopt it in routine practice, including operative dentistry field. 1. Rubber dam offers the practitioners with a wide variety of advantages, such as isolation of the operative area, provision of aseptic field, improving infection control, preventing ingestion or aspiration of burrs or instruments, as well as protection and retraction of soft tissue. 2, 3, 4, 5. Other advantage is increased patient comfort, with a positive opinion about rubber dam application. 6. Operative dentistry field is a major area where rubber dam is used. 7. Moreover, rubber dam use should be re-evaluated from a medicological point of view, considering an increase in malpractices directed against general practitioners. Failure to use M is used. 7. Moreover, rubber dam use should be re-evaluated from a medicological point of view, considering an increase in malpractices directed against general practitioners. Failure to use rubber dam has been described as a serious departure from the standard of care. 8. With all these advantages, as well as the legal aspects favoring rubber dam, but many practitioners still resist its use in routine care. They claim that it is time-consuming and uncomfortable for the patients. 9, 10, 11, 12, 13, 14. Training on rubber dam application has been considered as an integral part of the contemporary dental education. Many dental schools advocate the use of rubber dam by their students from the first meeting with the patient. 2. Since surveys among dental students are helpful tools to draw the outline of the future dental workforce. So investigating dental students' perceptions and attitudes toward rubber dam use will contribute to underlining the inherent problems related with the implementation of this worldwide acknowledged methodology. Depending on the results, strategies can be developed to enhance the way of contemporary and high-quality aspects of clinical dentistry are delivered and instilled. The purpose of the present study was to determine the general attitude of Saudi dental students groups enrolled in 2 different private colleges toward rubber dam application, specifically focusing on operative field treatment, and evaluates the problems they encounter related with this tool.
Okay, so as we have seen, the rubber dam is very important as an introduction to this subject, and very helpful in dentistry in all cases with restoration and in the medical field, in the dental field. There is some analytics charts showing the percentage of answers given regarding the utilization of rubber dam. It is not very visible, this picture here, but this one is more visible. Bar chart showing the percentage of answers given to questions regarding attitude of students to use rubber dam. Very important subject. I think we have the results found in 2 students. Both dental colleagues agreed with the opinions that proper isolation cannot be achieved for the restoration of operative procedures without using rubber dam, and restoration placed under rubber dam have greater longevity than those placed without. This is very important to add to our text. To our notes. Talking about proper isolation cannot be achieved for the restoration of operative procedures without using, of course, the rubber dam, and restoration placed under rubber dam have a greater longevity than those placed without it. Then we should move to the conclusion. Within the limitations of the present day study, it can be concluded that the perceptions of dental students on rubber dam need to be improved, and strategies should be developed so that this valuable adjunct will comprise one of the indispensable elements of dental care. This is also, sorry about that, I didn't show you the highlights. We're talking about the conclusion of the presentation of present day. It can be concluded that perception of dental study of rubber dam need to be improved, and strategies should be developed so that this valuable adjunct will comprise one of the indispensable elements of dental care. We already copied that, and now we should paste it on the notes. Conclusion, rubber dam. This is one way of isolation in operative dentistry, of course, being the rubber dam. And next, we shall continue to see the introduction. Rubber dam is universally acknowledged as mandatory adjunct, particularly during endodontic treatment. Many rubbers advocate its usage in college practitioners to adopt its routine practice, field control prevention. This is all about the rubber dam here, with all these advantages as well as legal aspects of favoring rubber dam, but many practitioners will resist its routine care, routine use. Methods, results, table 1. Do you use the rubber dam during operative procedure for posterior amalgam? Sometimes most people answered, and rarely about 99 and 33 answered rarely. So they should use rubber dam more often, as it is a very important tool in medical, in dentistry, and this is the discussion has been made on this subject. And of course, the conclusion of the limitation of this study, we can conclude that rubber dam application has a wide acceptance among underground students. However, we cannot depend completely on this result of the survey, but it is acceptable tool to give an indication of what will be the clinical practice in the near future. What will be the clinical practice in the near future? And there is the financial support and sponsorship. Here we have the references about this project. Moving on to I think we have enough material now to work with and to get the ways of isolation of operative dentistry, to make a research and to make a conclusion, and to write it down in the text here. And I think we're only missing a video just to see what kind of rubber dam should be used. There is, of course, a problem with the showing of this material. We'll try to fix it. If we can. It has been fixed. Now, don't know if you can watch a video about this subject. Let's copy this ways of isolation operative dentistry. In a video to see what people are saying about this subject. Isolation methods used in operative dentistry, 22 minutes. And there is a rubber dam isolation operative dentistry, 7 minutes. In this video, we'll look at how to place and remove rubber dam, as well as additional techniques for authorizing isolation. Let's watch this video, as it is maybe an important video.
Next, punch a hole in the rubber dam using a hole punch, selecting the right-sized hole for each tooth. You can use a stamp that marks where to make the punches for a given arch.
As we can see here, this guy is making or pinching the rubber dam to fit the size of the patient's mouth. And this is a very important technique to put it in the patient's mouth. Let's watch more.
Ensure that the punches go completely through the rubber dam. Next, deliver the appropriately sized clamp to the tooth using a rubber dam clamp forceps.
And here he is delivering the rubber dam and with a clamp, as we can see here.
Check to make sure the clamp is stable and well adapted.
And now he's checking whether the clamp is stable on its place and, of course, well adapted to the teeth.
Check to make sure that the prong tips are contacting each line angle of the anchor tooth.
And now checking the anchors on the tips of the holes, if they fit in the teeth.
Next, pull the ends of the floss through the hole corresponding to that anchor tooth.
And this is a very important step here to check the anchor. Of course, fitting the rubber dam between the teeth is a very important technique to learn and to make it fit well while doing the restoration procedure.
You can use a blunt hand instrument to help pull the rubber dam close around the anchor tooth underneath the clamp.
And this way he is pulling the rubber dam inside the tooth using a blunt instrument to fit it inside the clamp.
You can use an explorer to tuck in or invert the dam around the cemento enamel junction of each isolated tooth.
This is an explorer, very commonly used in dentistry, in order to pull the rubber dam inside the cemento-enamel junction. So this video is, of course, a very important video in this showing us the removal of the rubber dam, the appliance of the rubber dam, and it is very important in the isolation, ways of isolation in dentistry, that we can include, one of which is the rubber dam. This is probably the video, and he is like doing this removal of a rubber dam, which is the end of the procedure, using a blunt object and removing the dam. And this is the video. We need no more of this video. But this, of course, tells us that rubber dam is very important in the procedure of isolation in operative dentistry. Now, this is research about ways of isolation in operative dentistry. This is the stream which is live now. Let's see it, if it's important. Video. But this, of course, tells us that rubber dam is very important in the procedure of isolation in operative dentistry. Now, this is research about ways of isolation in operative dentistry. This Sorry about that. This video is very important video discussing the rubber dam and explaining how the rubber dam works and how it is important in the procedure of dentistry. Sorry about that. This video is very important video discussing the rubber dam and explaining how the rubber dam works and how it is important. Anyway, we need to go back now and see more videos explaining how the rubber dam and more isolation procedure are important in operative dentistry. We have this video, isolation methods used in operative dentistry, which is 22 minutes, but should be important and very important addition to our conclusion and our project.
The first method of isolation to be demonstrated to you is the Erickson vacujector. The primary reason for the Erickson being developed was for both the comfort of the patient and the operator while using ultra-high speed in the washed field technique. The Erickson vacujector enables the operator to maintain maximum seeability in difficult areas of access and to work by himself without using a chairside dental assistant. In the Erickson vacujector kit, there are two hoses, one large and one small, used for evacuation, 5 various sizes.
This is, of course, a bit of an old video, but it is important in this excavator, the rubber dam, and has many information that is still useful till this day.
Ejector pipes, one special type and one regular type. Now I'd like to assemble the Erickson EvacuJect for you. When assembling the Erickson EvacuJector, it's important to have a container of water to make the assembling easier for the operator. The large evacuator hose is connected to the ejector pipe and to the high velocity evacuation on your dental unit.
Now they are talking about the evacuator, which is a very important sucking device to take off the water and saliva out of the patient's mouth.
The two ejector pipes that were described to you are the special pipe and the straight regular pipe. You can notice the difference in the stems of the pipe. One pipe is contoured and the other is straight. The contoured pipe will be used for patients that have a narrow arch and for pedodontic. For using the Erickson.
This here should be the injection of the evacuator inside the patient's mouth. This is the patient and this is the dentist. Probably gonna inject the saliva excavator in the patient's mouth, and this will work as usual, of course, and will do its job. I don't know if it is a description to explain this procedure. But I don't think there is. This one way is to use the one way of isolation in operative dentistry. Here we have another video. Probably this will be the last one we see today about ways of isolation in operative dentistry.
Hello friends, in this video we will discuss about the different methods of fluid control used during various operative procedures in dentistry. So while performing operative dental procedures in oral cavity, the dentist has to cope with soft tissues and fluids like saliva, blood and water spray.
This is the goals of isolation, being the first one, the retraction and excesses, moisture control, horn prevention, improve quality of treatment and patient confidence, all of which are used to give the patient a better experience with restoration and longer time and better isolation. Of course, there is a chemical and mechanical form of isolation. First one is the rubber dam.
It is used for the isolation of one or more teeth from the oral environment, and it can be used during tooth preparation, impression making or cementation of inlays and onlays. So the rubber dam kit contains rubber dam sheet, rubber dam holder, retainer or clamp, retainer forceps, punch and template.
These are the parts of the rubber dam. One is the rubber dam sheet, rubber dam holder. This is one. Retainer, which is a clamp. And we have the retainer forceps. This is the clamp, this is the forceps, this is the punch, and the template. Let's move on.
Template. The advantages of rubber dam are that it provides a dry and clean operating field. It helps in access and visibility to the area of interest. It results into the improved properties of dental materials.
This, I think, is very important to add to our research. We can write it down and as a dry operative clean field, access of visibility, improved properties for dental materials, protection for evaluation, operational efficiency. We can take a picture for this and use it later if we want. One second, let me save the picture, and this will be very important and useful capture to my research of ways of isolation in operative dentistry.
It helps in the protection of the patient and operator, and the use of rubber dam results into the improved operator. Incorrect use of rubber dam may damage porcelain crowns or crown margin or traumatize the gingiva.
These are the disadvantages: time, consumption, communication with the patient can be difficult, incorrect use may damage, patient may feel uncomfortable. Many disadvantages of the rubber dam, and many important advantage conditions where the rubber dam cannot be placed: cross-destructive the level of destruction, severely malalign a tooth, partial eruption, absorption material, cotton, pellet, gauze, and will fit in this subject. And of course, we need to understand it more, and we'll check it later. But for now, we will do the text. The text here, which is about the rubber dam. We don't have to say the rubber dam, we can just say proper isolation cannot be achieved for the restoration of operative procedure without using these isolation methods and restoration without using these isolation methods, and restoration placed under rubber placed under rubber dam, under them, can say under them, have a great longevity and those than those placed without, under as much of them have a greater longevity than those placed without, within the limitation of the present day. It can be concluded that the perceptions of dental students on isolation methods need to be improved, and strategies should be developed so that these valuable adjuncts will comprise one of the many of the indispensable elements in dental care. This is generally speaking of the ways of the isolation methods in dentistry. Ways of isolation methods in dentistry, one of which is the rubber dam. And of course we can continue. Let's see one more video, and this will be the last video, then we will return to the subjects we like the slide share, and of course this long research of attitude and knowledge of isolation over the field among undergraduate students, which was talking only about the rubber dam. Let's watch the video and we will comment on it. This is about the rubber dam placement anterior posterior. This is about rubber dam application for beginners, operative dentistry, advanced isolation technique, dental isolation, cotton rolls. We have operative dentistry, lots of video, split dam technique, all or many of them talking about the rubber dam. Maybe we should add something on the text telling that the rubber dam is the most important way of isolation in dentistry. Popularization can be achieved for the resolution of a procedure without using these isolation methods and restriction placed under as much of them as possible. Having greater longevity than those placed within the limitations of present study. It can be concluded that the perceptions of dental students on isolation methods need to be improved and strategies should be developed so that those variable adjuncts will comprise indispensable elements in dental care. Of course, this is not about the rubber dam, but still an important way of education. That is like, 1 second. Let's refresh this to show the page we are in. Okay, now we are on the page of YouTube. We discussed many operative dentistry, amalgam, nodes, rubber dam. I think we need no more video in this subject to explain the rubber dam possibilities and rubber dam benefits to the tooth, as we already discussed before. And these are that you don't know before whether monitoring dentist application, for methods, results, conclusion, and we already discussed this attitude thing. So we can delete and move to the next subject. And here we have this PDF talking about the rubber dam also here we can see rubber dam. And of course, there are many more isolation methods. We will write them down on the note pad right away. Proper isolation cannot be achieved. Let's write here most, or the most important method of isolation is the rubber dam. Of course, first we do have to write there are many ways of isolating the tooth from the or just during the dental procedure like we have the evacuator, we have the water syringe, we have the throat shield, we have the cheek retractor, we have the mouth prop. Let's write some of these methods because they are important, like the cotton and cellulose wafers, like using absorbent materials, then we can say that we can use low or maybe just volume excavator, volume evacuator, then we have the air water syringe, water syringe, we have the throat shield, and we have the cheek retractor, mouth prop is also a way of prop, but the most important method of isolation is the rubber dam. Let's read this loudly. There are many ways of isolation of the isolating the tooth during the dental procedure, like using absorbent materials, volume excavator, a rotor syringe, throat shield, check retractor, mouth prep. But the most important method of isolation is the using the rubber dam. Of course, there is pharmacological methods used to prevent or to isolate the tooth during procedure. Many methods actually are important. Then there is like methods for gingival tissue management. But we are interested in concluding the subject and writing a conclusion for this long subject of tooth isolation here, how it was invented, who invented it, and the traditional surgery of isolation of field is operative, even simple filling. Furthermore, an endodontic treatment should not be undertaken if there is no rubber dam, unless the tooth is damaged, which allow easy positioning of the rubber dam. Unless tooth damaged, which allow easy positioning of the rubber dam. As like we can write this, should not be taken. This is a very important words here, very important paragraph we can include in our research. This here, very important. As treatment, as endodontic treatment should not be undertaken if there is no rubber dam. I repeat, as endodontic treatment should not be undertaken let's try this. Is using rubber dam and endodontic treatments. Treatments should not be taken without using it. Let's see if that was correct. As endodontic should not be taken as endodontic treatment should not be taken if there is no rubber dam unless the tooth damage. Yes, it was correct. Treatment Let's try this correctly. But the most important method of isolation is using rubber dam as endodontic treatments should not be taken without using it. Very important words here we had that we added to our research. Let's move on to the next slide. Benefit of using rubber dam. The patient turn off from the ingestion. From the injection of the horse, aspiration small and to operate in a clean surgical field. Restoration and protection of the soft tissue, gums and cheeks. It is also famous manufacturer and the assembly of rubber dam, reduction of delays, and patient have to rinse their mouth every 5 minutes. The dentist and dental assistants against infection, and which can be transmitted by the patient's saliva. And here we have this important thing here. We have the dentist more comfortable, which can leave patient for any important dry field and protect the rubber down the patient. Lots of things, lots of informations, all talking about the importance of the rubber dam, contraindications for using rubber dam. We really don't need this, all of these pinches, frames, lubricant, napkins, dental floss, assistance, special aesthetic waxes. We don't need all of this information in our project or in our research. Sorry about that, I wasn't showing the page that I was talking about. That was a mistake, but here I was talking about this subject here, rubber dam, and their importance in this medical, in the history, in the dentistry. These are the parts of rubber dam that we do not need. These are the contraindications for rubber dam use. This is the dentist and dental assistant protection and infection and all the advantages coming from the rubber dam. I was talking about this here, this important phrase that we already use in our research. But of course, our subject, as we remembered it, was talking about isolation methods in operative dentistry. Conclusion. The conclusion of isolation methods used in dentistry. And this is only talking about the rubber dam and the importance of the rubber dam, the numerous conferences, sizes of rubber dam, formats of rubber dam, colors of rubber dam. This is the color of the rubber dam, which is here. This one. Let's move on to the next slide. We have the rubber dam punches, or pinches, 0 depending on the order. Rubber dam clamps. These are the clamps. And these are the dental floss, flossing between the teeth in order to fixate the rubber dam to the mouth. And we explained before the assistant's roles in helping the dentist, fixating the dental rubber dam into the patient's mouth, and the special elastic wires used. This is the shape of the rubber dam, the turning use. Methods of rubber dam. Second methods, pinching the rubber dam and fitting it to the patient's mouth using the many dentist clamps. And this concludes this page here. Rubber dam that we used only one phrase or one paragraph in order to add it to our research. Let's check the stream now. Everything seems correct. And here's the location in dentistry, our isolation in dentistry. These slides shows really have many slides. Contents, controlling holes, introduction, preparation of the rubber dam, position, putting holes in rubber dam lubrication, indication of using rubber dam bleeding. There are the cotton rolls, types of retraction cords, possible complications and corrective measures in isolation, swallowing and aspiring of the foreign bodies, and of course the reference. It's always about the rubber dam, and I do not find anything about the conclusion, about using isolation methods in operative dentistry. But of course we talked about the methods here being the volume evacuator, the absorbent materials, the air-water syringe, throat shield. We have the cheek retractor, the mouth probe, and of course the most important one being the most important one was the using of the rubber dam as endodontic treatment should not be taken without using it. I think this concludes our research today, ways of isolation in operative dentistry. Conclusion. Let's just give the summary of this paragraph, and this was our conclusion. Proper isolation cannot be achieved for the restoration of operative procedures without using these isolation methods. And restoration placed under as much of them as possible have a greater longevity than those placed without. Within the limitations of the present study, it can be concluded that the perceptions of dental longevity, perceptions of dental students on isolation methods need to be improved, and strategies should be developed so that these valuable adjuncts will comprise indispensable elements in dental care. There are many ways of isolating the mouth during the dental procedure, like using absorbent materials, volume excavator, air-water syringe, throat shield, cheek retractor, mouth prop. But the most important method of isolation is using the rubber dam, as introductory treatment should not be taken without using it. This was our conclusion, and I don't know if we should continue, but I don't see any problem with continuing this research, as we have slideshows, many slideshows here talking about the rubber dam, ways of isolation, these are the slideshows, and this was our research. How about this PDF? Operative dentistry, the use of cotton rolls, retractors, cord is an effective rubber dam isolation for restoration of non-carious cervical lesions. In additional, patient prefers gingival. Okay. This is a book talking about our research, talking about how to use cotton rolls instead of the rubber dam. And then we have like pictures. Let's see the best pictures to be used in this research, but probably nobody will. Probably I will not add these pictures because this is not my subject. My subject is only conclusion, and these are isolation form, moisture, dental methods, rubber dam, cotton rolls, HPs, absolute wafers, suction devices, drugs, indirect methods, goals of isolation, moisture control. Very important, of course. Moisture control, local anesthesia. Infection control, protect the patient from swelling. Patient-related. Let's save this image, because it might be, oh, sorry about that, I was not showing the correct place, but I will show what I was talking about just now. I deleted the two tabs were open about this tab was about a slideshow tab, a PowerPoint tab, talking about many subjects, but mostly about the rubber dam. And we had another tab talking about the same thing. So I deleted them because they are not related to my project, which is isolation methods. Conclusion. Then we talked about the pictures that I should not include in my project. But I saved one picture because it might come in handy later. And these are all the ways of isolation and the isolation methods used in operative dentistry. And this is all what I have to say for today's lecture. This lecture was about 1 hour or 2 hours long, 1 hour 36 minutes. And it was nice. We watched videos, we seen pictures, and we have written this amazing report. And We can do many things. Here, like, which will probably do nothing. This concludes our research. We don't have to do anything more. Thank you for listening, and thank you for joining this lecture or this research, this Google research on ways of isolation in operative dentistry.